Good morning, Payne Chapel. Here is your wellness check for today from worshiping into wellness. Today, we will be focusing on high blood pressure. Blood pressure is the force of your blood pushing against the walls of your arteries. Each time your heart beats, it pumps blood into your arteries. Your blood pressure is highest when your heart beats, pumping the blood. This is called systolic pressure. When your heart is at rest between beats, your blood pressure falls, and this is called diastolic pressure. Blood pressure is measured through a gauge, a stethoscope or electronic sensor, and a blood pressure cuff. Your blood pressure reading uses two numbers. Usually, the systolic comes before or above the diastolic number. For example, 120 over 80 means a systolic of 120 and a diastolic of 80. So the big question is, what is high blood pressure? Well, high blood pressure or hypertension is a serious illness that affects nearly 65 million adults in the United States. High blood pressure is often called a silent killer because many people have it, but they don't know it, and it doesn't have any symptoms. So, in terms of blood pressure categories, we know that normal blood pressure is having a systolic of less than 120 and a diastolic pressure of less than 80. And once it's elevated, it's considered between 120 and 129 systolic pressure and a diastolic pressure of less than 80. High blood pressure stage 1 is having a systolic pressure of 130 to 139 or a diastolic pressure of 80 to 89. And having a stage 2 is having 140 or higher or having a diastolic pressure of 90 or higher. Please seek immediate medical care when you have a systolic pressure of 180 and or having a diastolic pressure of 120. This is considered hypertensive crisis. Risk factors for high blood pressure include your age, your race and ethnicity because it's common in African American adults, being overweight or obese, being a male before the age of 55 and a female after the age of 55, certain lifestyle habits like eating too much salt or not eating enough potassium, lack of exercise, drinking too much, and alcohol and smoking, and your family history. Before making a high blood pressure diagnosis, typically your healthcare provider will take two or more readings at separate appointments. After you are diagnosed, you will work with your provider to come up with a treatment plan. It may only include lifestyle changes like heart healthy eating and exercise, and sometimes the changes do not control or lower your high blood pressure, and you may be prescribed a medicine. Please be aware when your blood pressure stays high over time, it causes the heart to pump harder and work over time, possibly leading to serious health problems in other parts of your body. These problems can include stroke, vision loss, heart failure, heart attack, kidney disease or failure, and sexual dysfunction. Some surprisingly interesting facts about high blood pressure. It may be linked to dementia. Young people can have it too. It usually doesn't have any symptoms, and many people have it and don't know it. Women and African Americans face unique risks with pregnancy, birth control, higher rates, and hospitalizations. Here's the key. You can take control of your blood pressure through checking your blood pressure, taking high blood pressure medications if every day if needed, exercising often, eating foods low in salt, losing weight or keeping your weight at a healthy level, not smoking, limiting alcohol, managing your stress, and talking to your doctor regularly about your pressure. Before we close, I think it's helpful for us to discuss how to best take your blood pressure at your home. Don't smoke, exercise, drink caffeinated beverages, or alcohol within 30 minutes of a measurement. Take at least two readings 1 minute apart in the morning before taking medications and in the evening before dinner, recording all results. Use a properly calibrated and validated instrument, checking the cuff for fit and size. Rest in a chair for at least 5 minutes with your left arm raising comfortably on a flat surface at heart level. Sit calmly and don't talk. Place the bottom of the cuff above the bend of the elbow and make sure you're relaxed. Sit still in a chair with your feet flat on the floor with your back straight and supported. And in close, You've got this. High blood pressure control is within reach. Have you checked out our Worshiping into Wellness YouTube channel? Please watch, like, share, and subscribe. I hope that you were blessed by today's wellness check. Until next time, this is the Worshiping into Wellness ministry at Payne Chapel AME Church, where we are only better together if we are safe